In our previous video, we explored West Virginia's unique qualities and characteristics. We highlighted the state's deep-rooted rural traditions, close-knit communities, and resilient spirit. Now we turn our attention to the significant challenges facing West Virginia. These challenges include pervasive poverty, the devastating impact of substance use disorders, and the high percentages of children in foster care. These issues profoundly affect the well-being of families across the state. In this video, you will hear from various voices within the community, from leadership and staff. They will share their insights and experiences, shedding light on the harsh realities and struggles faced by many West Virginians.
I do see a lot of fathers that's coming in under the TANF program and that are in recovery. In other words, they may have been, had a substance abuse issue, and they come and they take our recovery course class, and which trains them to be a life coach or recovery coach, and so they ended up helping other people, but in the course of helping other people, they end up helping themselves.
I would say normally interfacing with fathers, we don't do it as much as I would like to, but we have lately noticed an uptick in the fathers coming with the moms to the pantries. And I think that is where we've started inviting them to more things combined, like as family events. With Putnam County, I would say that is, with us personally, that what I've seen. The substance abuse, maybe out of if you put it in a percentage, maybe 25% of the people that I see are struggling with that, where you can see it, like obviously see it, that there's a problem there.
The drug epidemic that we have lived through is a major part of our problems, and we know that. My son, he overdosed and died on his brother's birthday, August 21st of 2021. And I'm a grand family. I'm raising my granddaughter. I adopted her 11 years ago. Both of her parents are addicted. Our mother, her biological mother, is still in the throes of addiction. Like, I shouldn't be a mom. Too old to be a mom, but I am. And Jeremy gave me something nobody could. I had sons, and he gave me a daughter. And it changed how I wanted to help.
Our interaction with people experiencing substance use disorders, and especially in the form of opioids, is huge. A very large portion of our families have some sort of substance use disorder. Moms, dads, grandparents, and unfortunately it is the most difficult population to work with, because we know substance use disorder just changes your entire brain chemistry, and that's kind of all that you can fixate on. So it's a big one.
The top two challenges that we see the most of is income and with jobs and opportunities for jobs on that end of the county. Of course, we serve the entire county, but we're just located on the western end. And substance use disorder is a big thing for our end of the county also.
I would think fathers need as much, if not more than anything, to deal with substance abuse is just support. Knowing that there's people out there that have their back, that are willing to and able to give them a hand up. Dads and everybody, they just need to be supported. They need to know somebody's there for them.
A lot of my male clients just confide in me, and we can share in the issues that are facing parents. I think it's really hard to take on a role and have to be both mom and dad when you thought you were just going to be dad. And it's a really hard thing to then become a working dad in raising kids and having kids mouth off to you and having no program, no support that is teaching you how to have this conversation. I as a parent could benefit, but I have a community, right? If I'm a dad just working to do my best, I may not have that community in West Virginia. A lot of fathers have criminal records. Non-expungible felonies are a really big problem. So I have hardworking father clients who have criminal records, and the crimes are not expungible in the state of West Virginia. Big barrier, just on its face. You have a non-expungible felony, you're not going to, and a non-expungible, not just under West Virginia state law, but a disqualifying felony for your big corporations. You want to work at a grocery store and you have certain felonies, they run a background check, you'll never work there. You want to work at a big retail store, you have a certain felony, you'll never work there, ever. And when you eliminate large employers as potentials for people with criminal records, then it's essentially begging Joe Schmo to take a chance on you. And then there's that imbalance of power. You're not going to get the same benefits.
We have so many fathers right now in our county raising their children without mothers, which is something that you don't expect it. I had a father who came in the other day who said, Donna, my daughter is going to be going through the changes soon. What do I do? He didn't know how to address his daughter having her monthly period. I mean, that's not something a man should really have to address. But I told him, I said, well, at least you came to us and asked us, because I can help you.
I think in our area, fatherhood is the bad guy. Fathers get the bad rap. Fathers are the ones that leave, don't do anything, that are I have 3 kids, but if you count my husband, I have 4. I don't think that fathers are given enough empowerment in their role. I don't think that fathers are given enough support, and I think that that comes out of the bias that we have of the way our own fathers raised us.
There is nothing more frustrating than trying to make somebody pay or suffer for something they did to you when life is making them pay for it every day. Some people are in so much pain that no matter what you can do to them, you can't make the pain worse.
Housing issue is astronomically present. And truly it's because West Virginia puts the cart before the horse every time. We have that as well when parents separate and then there's a custody dispute and then mom or dad end up displaced from their home and then they have to find permanency somewhere. But they're also facing poverty. So how can I get a home when I don't have a down payment for an apartment plus first month's rent and deposit? That's $2,000. I don't have that money. Also, I don't have a car to get to work. So how am I supposed to come up with that money?
I've trained folks in Circle of Parents. I've trained folks in other groups, and we're not having luck with groups. Fathers groups, mothers groups, parent groups. We just can't get folks to have continued interest.
One thing that was shocking to me, and this wasn't just at the conference, it was in the community. One might assume that substances primarily affect men, but as we traveled around the last couple of days, a stereotype that I had, if I had to point out one, was that it was a male issue. Every day, I saw probably equal the amount of women who were homeless or on the streets or asking for help. Or even yesterday morning, we were at breakfast and I saw a lady, and it was early, and it was clear that she had a mental health challenge, right? She was having a full conversation with herself and somebody else. But if I had to point out something that I thought would have been a stereotype, I would have assumed that was predominantly a male issue. I've been in 3 different rooms the last couple of days,
And it seems like this is equally affecting people across West Virginia. And that's like shocking to me.
Just say something on that, Patrick, first, because, we had that slide where we were asking why are men more likely to use, right? Because I was half expecting someone to make that point, because I was thinking, I bet there's an awful lot of women using too.
Yeah. Yeah.
All the same thing in my travels.
Yeah. Yeah, it was, so I asked the question in 2 different settings the last couple of days, and somebody pointed out that one reason why the stats say men use more is because moms are home taking care of kids. And in the same minute, somebody else in the same room said that's not always the case. So that's an interesting dynamic that I haven't seen, and I've been a lot of places.
As we conclude our discussion on these critical problems, we now turn our focus to the efforts being made to address them. In the next segment, we will explore the work being done across the state. We'll delve into the various service models, highlight the contributions of funders and stakeholders, and examine the wide range of services provided to support families.